Welcome back. Whether you're in your 60s, 70s, or beyond, taking care of your body and mind is the key to enjoying life's next chapter. Unfortunately, some common habits can quietly undermine your health. Today, we're highlighting 7 mistakes older adults often make and what you can do instead. As always, talk with your doctor before changing your routine. Number 1. Skipping vaccinations and checkups. Many seniors think vaccines are just for children, but nothing could be further from the truth. The CDC recommends that adults over 65 get annual flu shots and consider COVID-19 boosters, plus vaccinations for pneumococcal pneumonia, shingles, and RSV. These vaccines protect against serious illness and complications, yet skipping them leaves you vulnerable to hospitalization and long-term effects. Regular checkups serve a similar purpose. They screen for high blood pressure, high blood sugar, high cholesterol, and abdominal aortic aneurysms so problems can be caught early. Even if you feel healthy, schedule a visit to your provider for screenings, vaccination updates, and lifestyle advice. Staying proactive helps you avoid preventable diseases and keeps you connected to a healthcare professional who knows your history. Number 2. Not managing medications carefully. Older adults often take multiple prescriptions, which increases the risk of drug-drug interactions, overdosing, or underdosing. The Merck manual notes that medication-related problems in seniors include adverse drug effects, non-adherence, and inappropriate dosing. These adverse effects can lead to confusion, falls, constipation, bleeding, and other uncomfortable or dangerous symptoms. Hospitalization rates due to adverse drug events are 4 to 7 times higher in older patients. Common preventable causes include drug interactions, poor communication with providers, inadequate monitoring, and patients not following instructions. To avoid mistakes, keep a list of all your medications, ask your doctor or pharmacist about interactions and side effects, and use pill organizers or reminders. Number 3. Leading a sedentary lifestyle. An inactive lifestyle weakens the body and sets the stage for chronic disease. According to Medline Plus, sitting too much causes you to burn fewer calories, lose muscle and bone strength, and weaken your immune system. People who remain sedentary are more likely to develop obesity, heart disease, high blood pressure, high cholesterol, stroke, type 2 diabetes, certain cancers, osteoporosis, falls, and depression. Fortunately, you don't need to run marathons to reap benefits. Start by adding light movement throughout your day. Tidy up the house, garden, walk around during TV commercials, or stand while talking on the phone. Then build up to regular brisk walks, chair squats, wall push-ups, and gentle stretching. Physical activity improves mood, maintains mobility, and makes daily tasks easier. An investment in your independence. Number 4. Ignoring nutrition and hydration. Skipping meals, eating too many processed foods, and not getting enough protein or fiber can sap your energy and weaken your immune system. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, beans, and nuts helps control weight and can lower your risk of osteoporosis, heart disease, high blood pressure, type 2 diabetes, and certain cancers. As you age, you may need fewer calories but still need plenty of nutrients. Some older adults even need more protein to preserve muscle mass. Avoid empty calories from candy, soda, and fried foods, limit saturated and trans fats, and choose healthy fats such as those found in avocados, olive oil, and fish. Hydration goes hand in hand with good nutrition. Seniors often have a reduced sense of thirst and lower body water content, meaning that by the time you feel thirsty, you may already be dehydrated. Dehydration can cause fatigue, dizziness, and confusion, and it is a common reason for hospitalization. Drink plenty of fluids throughout the day. Carry a water bottle, opt for herbal teas or low-sugar beverages, and include hydrating foods like cucumbers, celery, and watermelon. Medline Plus also reminds us that some medications can dry out your mouth, making hydration even more important. Number 5. Neglecting fall prevention. Falls aren't just accidents. They are the leading cause of fatal and non-fatal injuries among older Americans. 1 in 4 people over 65 falls each year, resulting in 30,000 deaths and 3 million emergency department visits in 2021. Falling once doubles the risk of falling again, and costs to treat fall injuries are projected to exceed $101 billion by 2030. Risk factors include lower body weakness, walking and balance difficulties, vision or hearing loss, certain medications, chronic conditions like diabetes and arthritis, and hazards such as poor lighting and clutter. To reduce risk, do strength and balance exercises like heel raises and single leg stands. Check your eyes and hearing regularly. Review medications with your doctor. Install grab bars and improve lighting at home, and remove throw rugs or obstacles. Fall prevention programs and classes can build confidence and teach you how to move safely. Number 6. Neglecting mental health and social connections. Aging is full of transitions: retirement, family changes, and health challenges. Around 14.1% of adults aged 70 and older live with a mental disorder, yet mental health conditions like depression and anxiety are often under-recognized and stigmatized. Social isolation and loneliness, affecting about 1/4 of older adults, are key risk factors for depression, cognitive decline, and heart disease. The National Institute on Aging notes that isolation is linked to higher risks of heart disease, depression, cognitive decline, and early death. To protect your mental well-being, stay connected. Join community groups, volunteer, take classes, or connect with friends and family via phone or video calls. Reach out for professional help if you experience persistent sadness, anxiety, or loss of interest. Meaningful social activities can improve life satisfaction and reduce depressive symptoms. Number 7. Shortchanging sleep. Many people believe that older adults need less sleep. In reality, the CDC states that people aged 65 and older should aim for 7 to 8 hours of sleep each night. Quality sleep helps your immune system, heart and metabolism, supports a healthy weight, improves mood and memory, and lowers your risk of type 2 diabetes, heart disease, high blood pressure, and stroke. Yet shortened or interrupted sleep is common. Experts note that problems such as noxuria, arthritis, and sleep apnea often disrupt rest. Studies show that sleeping fewer than 5 hours increases the risk of falls and fractures in women over 70, and men whose sleep is interrupted demonstrate poorer physical functioning. To sleep better, stick to a consistent bedtime and wake-up time, keep your bedroom quiet and cool, turn off screens at least 30 minutes before bed, and avoid large meals, caffeine, and alcohol before bedtime. Regular exercise and a balanced diet also improve sleep. If sleep problems persist, consult your healthcare provider for evaluation. Sleep disorders like sleep apnea can be treated. Conclusion. Taking charge of your health doesn't have to be overwhelming. By staying up to date on vaccinations and screenings, managing your medications wisely, moving your body every day, eating a balanced diet, and staying hydrated, preventing falls, nurturing your mental health, and getting adequate sleep, you empower yourself to live independently and with confidence. Small, consistent changes can have a big impact over time. Thank you for watching. If you learned something new today, please like, subscribe, and share this video. Let us know in the comments which healthy habit you plan to focus on. Remember, your health journey is personal. Every positive step you take brings you closer to a vibrant and fulfilling life.